Okay, we're going to talk about the roles and responsibilities of the paramedic. And I just want to hit what we're expecting out of you once we get you through the course. And these topics are what we're going to really touch on here. Personal and professional development is a big thing. Ethics and your attitude is going to be a huge part of what we're going to be grading you on as well, and looking for you at the end of this completion of the course, as well as making sure you're able to continue your education process up even once you leave here. Now, these are the standard roles that we'll see. One, obviously, getting prepared, the response. The season size up is going to lead everything to you. That's basically how you're going to build up from this. But then it goes on without that. So your triage, your treatment and management, how you're going to determine whether the patient needs to be transported or where to, making sure it's appropriately documented, and then after the end of the call, getting everything's cleaned up, back in service as quickly as possible so you're ready to go for the next one. So there's a lot of things that are going to come to play. Not only physically, staying up late, lack of sleep at certain periods of time, but emotionally getting through the job with the type of calls and the continuous stress that's going to come with these high intense issues. You may be asleep at one moment and wake up. You may be awake for 12 hours straight through the evening going on calls. And so what's going to prepare you for something like this? When you go to that kid who had the shotgun and shot off the front of his face, and you need to intubate, and you've got no anatomy and you haven't seen this. So these are the things that you've got to figure out. Are you going to be prepared for these? There's a lot of instances like this, that the one call that ended that person's career. So we want to make sure that you have an emotional outlet, a way to deal with the stressors that come with this job, being able to talk to somebody, and at least when you're on scene, being able to competently manage this patient. You may be the only medic on this scene, and you've now got to manage this airway, and you've got to manage this patient. What are you going to do? How do you prepare yourself for this so you're ready to walk into the scene and take care of it? So a lot of different things that are going to come into play. Beyond this, there's also the penetrating trauma. So you get something like this. You can see this tree branch is going right in through her neck, chest area. This is going to be another difficult call. We always talk about penetrating trauma. We think about gunshot wounds. We think about knife stab wounds. But what about with trees falling? We've had several wind events in Spokane County area where trees fall. People have been impaled. People have been killed by this. We had a gentleman with a large tree branch impaling in his thigh. So how are you going to cut that branch to free them from the tree if they're caught up in the tree? How are you going to stabilize that? How are you going to transport that patient when the tree branch is through and coming out the back side? How are you going to manage that patient's airway? All these type of questions are the things you have to come up with a solution. There's going to be people who are going to be looking at you. Yeah, they can cut the branches up, but you got to know when to release compression. If they're in a crush injury, when to get set up and go the most, and that's responsibility is going to be on you.
Now,
Our
safety is going to
biggest
be our number
response,
one
though, is
priority in our
to
response.
ourselves. You and your
We want to
crew's
make
safety
sure
is
that we
utmost
get there
priority.
and we're
Now,
able to take care of the scene.
as
Again,
I've
this
always
is their
been told,
emergency, not ours.
the
So
emergency,
we got to make sure that your crew is safe, you are safe, and we get there. That extra speed is not going to save you but 30 seconds, 40 seconds, which is not going to make a huge difference. But if you don't make it there, that's going to make all the difference in the world. And now we've got another scene that we have to take care of. Once you get on scene, you need to size the scene up. You need to find out, is this area safe? You look at an event like this, especially with our wind events coming down, those are all potential live wires. So we really have to know that. We have to look into the area. Is it dark? Can I light up the scene? Is there a large crowd and I better get law enforcement there to protect me? Again, number one priority is always your safety first, because if you come part of the incident, now more people have to come in to save you. Patient assessment. Again, first, general appearance. This is our look. Sick, not sick. Immediately, what our impression is on the patient. Then we're going to assess our ABCs. Primarily, are they breathing? Airway open, patent. Do they have any major bleeding areas? Then we'll start going to go over and do a physical examination, our rapid trauma exam, if you will, or our medical exam based on what scenario we're going to do. Getting our history, especially our sample history, is going to be huge to find out what's going on. And then we're going to reassess our patient. This is all stuff you guys already know and should have done significantly as an EMT. Once we get that, our first aspect is basically is that triage. Okay, is this a sick patient or not? Do I have time to stay and play and ask questions, or do I need to load this up and go? Is this a trauma situation where this patient is not really injured and I can talk to him and assess him, or is this someone I got to pack up and go and I'll work on IVs and that in the back of the ambulance? All those decisions we're going to get you set so you guys are able to make those on your own, because that's the critical difference between a critical thinking medic and just your standard medic. Now, it's also the protocol. So we got to make sure that we're treating the patient appropriately. We know what our protocol, so we know what we can do and what we can't do. Now, there's going to be times that we're going to call, the hospital and say, hey, I think we can do this. Is that okay? Um, I want to come to this hospital. I need to bypass this. Is that all right? So there's a lot of things that we will have to do as far as managing our patient and determining where we're going to transport them as well, and what treatments we can do. And so we're going to make sure you guys are well prepared for that. Um, what type of transportation are we doing? Are we doing air? Are we doing ambulance? How long do we have to go? Are we taken to a community hospital? Are we taken to a level 2? Or do we need to get this patient immediately stabilized so we can go to a level 1 for like a burn system? Is this something where I've got a diabetic patient where I can give them some sugar and then I can release them to their own accord after I make sure that their blood sugar up? All those things are going to be the appropriate decision, because obviously sometimes it's appropriate to sign a release and not to transport, or let the patient transport on themselves. Again, when we're making those decisions, we have to decide what we can do, those that we can treat and release, those that we can't. We'll talk about those um, more again, of when releases, when you can release and when you can't, when you feel it's appropriate, and pushing those and how you document those as well. So it's all part of the decision-making process that you have to do from right off the bat. When we are doing the patient transferring, you know, we got to be watching out for our patient. Primary care is doing them, not doing our report. And we're going to pick up that reports when we do our patch reports. We're giving that appropriate information over. And then once we get there, is giving them a more detailed area so they can go by the history. Again, your history is going to be huge. The best history you can get from the patient, the better treatment you can provide. And that patient's really going to tell you what's wrong with them in a sense if you ask the right questions. And that'll be the definite thing we'll be focusing on. And then lastly, you got to document it. Again, if you didn't do it, didn't document it, it didn't happen. So it's putting it down in the process, and we talk about chart format is what we're doing. For some of you, you may have been charting for a long time. For some of you, you probably never filled out a chart potentially. So we want to make sure we're teaching you how to do that, how to document everything, how to go through an appropriate system, because that's going to be another aspect you're going to be doing in your preceptor and clinical time that we're going to be judging and grading you on in your patient care. So keeping it accurate and then in a timely manner. That's going to be the other thing. I know for any of the departments I've worked on, we've got 24 hours to get our report in. So we're going to expect that from you. We actually give you a little bit more leeway on those as far as getting reports, but I want you guys to practice as if you're going to be hired into a department, and we'll go by their protocols. And some of you work for departments and you know how these go. So we're going to follow those, and we're going to do several exercises along the way to get you ready so you're ready to go on these. Once we get back into service, that's the biggest thing. It's the hardest part. We have people don't enjoy as much, but we got to get those engines back in service. We got to make sure we've restocked every supply, remember everything we used, so on the next call we have everything in place. If you're on an ambulance, we got to clean it up the back and get ready for that next patient. We got to make sure our trucks are fueled up and ready to go. And we basically, on those tough calls, it's basically talking to the crew member. Are you okay? How'd you do on this one? And we got to watch out for each other as well. And I know Gary's going to be talking about that. Our big aspect that we always do is we also work with community involvement. So we become teachers. Yeah, we're the primary support basically out there, but we want to help with teaching people the hands-only CPR. What can be done from their standpoint to help us out with our job. And then also we'll do, again, professional development. That's going to be another aspect of promoting you and getting you on, because part of your role as a paramedic is going to be teaching, and we'll expect you to do that as people have done for you. Getting involved in the community that you work in is going to be huge in there too. Knowing what you can do, what else you should be doing, how you can help in different events, and getting out there, especially when you work for a department. There's a lot of things you can do for events out there and promote your department as well. So a lot of different things, and that's what we really try and get here, is getting that community support behind us, and we'll talk more about that as well. So what is the primary care? Well, that's going to be us for a lot of the places. We'll be that initial support. Um, but we want to talk about paramedicine, and I'm going to jump into that in a later event, and we'll talk that lecture of what we're trying to do for the community and get that up there so that we're having less of our frequent flyers, if you will, and establish those. So that's going to be another big push we're going to be doing in Spokane County is that paramedicine, and then getting our citizens involved. So um, here, this is again, we do this for a paramedic program where we bring some citizens in who come and take a look of what we're doing, and they get our approach of things. They're kind of judging and grading us of what they see. We get our customer survey cards back from our departments to go in so that they know that we're treating them well and we're looking out for their best interests. Again, our priority is always going to be our patients. They're our number one customer, and we want to provide service whether it's 2 a.m. in the morning or it's 2 in the afternoon call. With your personal and professional development, this is stuff that's going to keep you moving, learning, and growing. Whether that be in teaching, whether that be in research, whether that be in studying, however it is. And there's multiple different ways to do that. We're going to be pushing you on a little research and presentation because you guys are going to be teaching OTEPs as a medic. You guys are going to be respected more out of you. And again, you're going to be the leaders on scene. So it's doing those leadership classes and everything else to get you there. Here's just to name a few of different things that you can do once you have your medic. Whether you're working for a fire department, you can go to Life Flight, work as a flight medic. There's areas to work on boats and that up in Alaska. You can go into the military. There's so many different aspects that you're going to be able to take and use this degree at. And we're going to help you along that process too if you're looking for other options out as well. But there's a lot of things that you can do and grow with this degree when you get done. But professionalism, I talked about, this is part of your grade. This is what we expect of you. How you maintain, how you hold yourself, your integrity, your attitudes towards patients and other professionals. Huge aspect that we're going to expect from you. And as an INSHS student, we're going to expect you to represent us in the field until you go out. And once you graduate, people are going to expect you to be higher standards because of that. Here's just talking about different ways of professionalism. Again, that's one of the big things we push with you guys, and it's a huge part of your grade because of what it means. We talk about what the citizens are looking for, and they're going to see you that one time. That's their shot. It's not 95% you're great, but 5% you're bad. No, for them, that's their one time to shot, and they expect you to be 100% perfect every time. There's going to be a set of professional ethics that we follow. We'll talk about morality versus ethics of what we do and making those right decisions. But ethics is basically what we as a group think, whereas morale is what you as an individual think. And we have the ethics and guidelines that we stand here of what is right, what is wrong, and we expect you to be following that and become ethical medics, as well as that's part of becoming a professional medic. Attitude is everything. Every time you're there, that patient is like your grandma. It's like your daughter. It's like your mom and dad. It's like your brother or sister. You treat them like family. Hopefully you like your family. But that's what it takes. And it's making sure that you're not on there and you're guessing what you're doing. You know what you're doing. You're not having to look up drugs on a chart because you've got it memorized and you know what you need to do. Taking the refresher course, taking continued things to keep up your knowledge so you're not losing things. Here's just the EMT code of ethics, and you guys may have seen this in EMT class. I'm not going to go into specifically on there, but it's how you treat that patient and what you do. Yes, this may be the frequent flyer who you've been on so many times, you still have to treat it like it's your first call. But the other things you can do on those frequent flyers is figure out what's wrong, figure out the problem. Do I need to call Spokane Cares team? What can I do so that they're not a frequent flyer for me? Those are the things you should be thinking, not just, oh no, I got to go to them again. But to be a true professional, you should be looking at what can I do to change this so I'm not going on this gentleman every day or this family up there. How can we help them out? Because that's realistically what we're looking for. It's not just going every day and completing a part of the problem and taking them to the hospital, but it's how can I fix this and come up with a better solution. Some cases there may not be one, but that's what we're looking out of you as well. What are those professional attributes? Well, obviously we've talked about a bunch of these before, but all these are things that we expect you guys to be doing. I assume most of you are already doing these things, but here's just a list, and just be aware of that. But these are high things. Again, in our interview process, we talked about 4 of these skills, and again, we think all of these are very important. So these are all attributes we expect you to know and do. But the other big thing is again, especially on the EMS scene, you're going to be the leader. You're going to be orchestrating the team. Doesn't mean you're doing everything, but you need to be that main advocate for the patient. You need to help orchestrate, use people's strengths, know what their weaknesses are, know when you need to step up and when you need help, and how to kind of coordinate those, as well as working with other medics and other professionals as well. Working together to be the best aspect you can for that scene, that scenario, that patient. And that's only going to happen once you leave here is keep nipping your continuing education. If you're not learning, you're dying. And that'll be a huge aspect. We're always doing classes here. There's classes in your apartments. The best thing I can say to do is teach too. If you go to teach someone, you'll find you'll study twice as hard as you have to do because you'll be waiting for those outside questions and making sure you know it. That's one of the biggest ways I learn is not only learning the material, but how can I teach this to someone else? And I have to know it that well or even better to be able to teach it to someone. So those are the big things that we're looking for here, just to make you, again, a better medic. And these are the things we're watching and expecting out of you. Hopefully, hopefully this was just refreshing talking to you and nothing new to you, and you guys are all ethical and fantastic medics for us.